Thank you for joining us another edition of To Your Health here on Facebook Live. I am your host, John Lazarou. Okay, so we've all heard the phrase, the struggle is real. Yes? Yeah? Okay. Well, those words couldn't be more true for the 24% of women in the United States who are battling some form or some type of pelvic floor disorder. Okay? So let me put this in perspective. So imagine not being able to play with your children or grandchildren because you're afraid that you might have some urinary incontinence issues, or that you cannot exercise because the pain is just really hurting you, okay, and you have extreme discomfort. So joining us today to help us deal with pelvic floor disorders and urinary incontinence issues is Dr. Stephanie Jacobs. Dr. Jacobs is a member of the GBMC Urogynecological team, and she's also a female pelvic reconstructive surgeon with GBMC Health Partners. Dr. Jacobs, thank you for coming today.
Thank you.
We have a lot to get to, so let's get rolling. So let's start off first. What is pelvic floor, and what are the is it pelvic floor muscles or pelvic floor muscle?
It's a good question. It would be muscles. So we think of the pelvic floor, just kind of generally speaking, as a bowl of muscles, really, that the bladder and urethra sit in, that the vagina sits in, that the rectum sits in, and they certainly impact a number of different issues for women, and their health is important for women, for both bowel and bladder control, as well as some issues of pain or prolapse or other things along those lines.
So let me ask you this question. Is pelvic floor muscle health important in the overall health for women?
Yes, absolutely. It is something that's very important, and we actually have a physical therapist who is focused on some ability to improve the health of the pelvic floor muscles. So it's something that is definitely key for us in the health for women for incontinence and other pelvic floor disorder issues.
Okay. So we talked about the importance of pelvic floor muscles and the pelvic floor regarding the overall health, but here's the question that I want to ask you. How aware are women about their pelvic floor health?
Well, I think it's one of those things that you're not necessarily aware of it until there's an issue. So I think you know, on a normal basis, when the bladder is working, there's no leakage, there's no pain, there's no prolapse, people aren't aware of it. I mean, you don't think about it on a regular basis. But I think for us, one of the key things is as soon as that basic function, that sort of thing that you just take for granted starts to break down, then people can be quite aware of it.
We're going to get to urinary incontinence relatively soon in our discussion, but let's stick with the pelvic floor. So we talked about pelvic floor disorders, 24% of women in the United States that are dealing with. That's a very high number. So quickly, what are pelvic floor disorders?
So pelvic floor disorders are really, it's a quite broad term. So it includes incontinence. It can include pelvic organ prolapse, which is a loss of the vaginal support. It can include certain bladder pain issues, certain bowel issues, various pain factors.
And what are some of the symptoms and what are some of the common causes of pelvic floor disorders?
So the two main ones that we think of are urinary incontinence, which there are a couple of different main causes for, as well as pelvic organ prolapse. One of the biggest leading risk factors for those things are as women get older and when they've had vaginal births.
Okay. We in the intro I talked about it's not pelvic floor disorder, it's pelvic floor disorders,
yes.
Right? So there are different types of a pelvic floor disorder. Could you just quickly go over what those are and what are some of the maybe symptoms or common causes of those disorders?
Right, so so it can be quite broad. So when we think of incontinence, it could be a weakness within the support of the urethra, which is the tube that women urinate out of. It could be for issues of signaling to the actual bladder. It could be, you know, certain women have trauma, whether it's, you know, kind of an abuse trauma or whether it's a physical, like a car accident or something like that, that can throw the pelvic floor off, or an injury to the knees or hips, and, you know, things like that can certainly throw off the pelvic floor and cause dysfunction in that sense. There's certain neurologic issues that can also impact.
So we spoke about your credentials. You know, you're a pelvic floor reconstructive surgeon. You're also a member of the urogynecologic team over at GBMC. My question to you is, though, who treats pelvic floor disorders? You also mentioned physical therapy. So can you give us from like beginning to end who would help treat pelvic floor disorders?
Sure. So it depends a little bit on the type, but I think that when women are suffering from these things, first of all, it's really important to, if you are suffering, to try to talk about it, and I don't think that's always easy. We find that less than half of women who have these issues present for care because it's not an easy thing to talk about, whether it's leakage of urine or whatever it is. So I think that's the first step, is presenting, whether it's to your primary care doctor and they can funnel you in the right direction from that standpoint, or your gynecologist. From our standpoint, we in our group, as far as myself and my partner, we've gone through training for obstetrics and gynecology, so in specific women's health issues, and then have done additional training focused on really these specific issues, so pelvic floor disorders, incontinence, prolapse. So we have that as far as the medical care side of things, that kind of area of expertise, but we do work very often with physical therapists and in conjunction with them.
Joining us today is Dr. Stephanie Jacobs, a member of the urogynecology team at GBMC and a pelvic floor reconstructive surgeon with GBMC Health Partners. I encourage our audience members and those watching us on Facebook, please submit your questions. If you're worried about privacy issues, you can do it through the comment section on our Facebook page. We actually do have a couple of questions from our studio audience. Laura, can you tell us what those questions are, please?
Yes, I can. So we actually have several questions related to pregnancy. So the first one is, does having an episiotomy reduce your chance of having urinary incontinence post-birth?
That is an interesting question. I will put this out there that I don't do obstetrics anymore, but typically we don't recommend episiotomies on a regular basis. There's actually more for bowel issues than for urinary issues. They were shown to, especially certain types of episiotomies, actually increase the likelihood of a tear for women. That could even go all the way through to the rectum, through some of the muscles that help with bowel control. So we tend to think of it more as an issue for that. I'm not aware of any direct relationship between episiotomies and urinary incontinence, but certainly a vaginal birth in general, a vaginal birth that might need have made somebody want to do an episiotomy could have meant a bigger baby and things like that, which that could have increased someone's risk of incontinence afterwards.
Okay, so in relation to that, we actually have a question asking if the size of the baby affects risk.
So we think so, but we don't have perfect information for that. It's really, we kind of generalizably think of it as the actual process of a vaginal birth. Now, if it's I think it goes, somewhat related to that. If it's like an 11-pound baby or something like that, it's going to be more traumatic. But a small baby, a normal delivery, still puts women at an increased risk.
Okay, and we have one more question related to pregnancy. I know this
great,
is not your specialty anymore.
No, well, this is, but just not the actual delivery.
So this is a question from our people watching via Facebook. They asked, does the risk of pelvic floor disorders increase with the number of children that you have?
That's a great question. So there have been some large studies that have looked at these issues, and it seems that it's really the first, so to some extent, but it's really that first delivery that causes the prime amount of injury to the pelvic floor. So after that, it's maybe some increase, but not as significantly.
Again, joining us today is Dr. Stephanie Jacobs, member of the urogynecology team over at GBMC and a pelvic floor reconstructive surgeon with GBMC Health Partners. We talked about pregnancy, right? So that's a certain stage of life, okay? So before we get to urinary incontinence, one last question about pelvic floor disorders. Why or why not should pelvic floor disorders be considered a part of aging?
So we we know that they become, so thinking of incontinence and prolapse and things like that, they, not so much the pain issues with pelvic floor disorders necessarily. We see them happen much more frequently as women get older, but we try not to consider them a normal part of aging. I think there are a number of patients who've come in where, you know, they've talked to physicians and this has just been written off. Well, you're older, yes, you have leakage, okay, you're wearing diapers, just live with it. That's just something that you have to deal with, and that's the piece of it that we don't consider it normal in that sense, and there are options to help with therapy and treatment for it.
Okay, so let's go back to urinary incontinence. Okay, let's talk about that. Well, give us a generic explanation of what is urinary incontinence.
So urinary incontinence, it's an involuntary loss of urine. So, you know, you're not meaning to, but you're leaking, whether it's with a certain event or even without awareness.
Okay. One of the questions that was submitted prior to our show is, is urinary incontinence a normal part of aging? And do pelvic floor disorders contribute to an increased incidence of urinary incontinence in women as they age?
So, I guess I'll take that. The urinary incontinence definitely increases with age. Especially, there are two main types of incontinence. There's what we consider stress incontinence, which is leakage more with something like a cough or a sneeze or exercise. And then there's urgency incontinence, which is, you know, I have to get to the restroom and, you know, clear out of the way, I can't make it, kind of leakage, that urgency. And that type of incontinence, especially the urgency incontinence, really increases with age. Again, we don't consider it normal, but definitely more common.
We have a question that was submitted by Audrey. Audrey wants to know, why do I have more incontinence issues at night when getting out of bed to go to the bathroom? Incontinence creeps up on me with a sudden urge, and then I cannot stop the flow. Why?
So thank you, Audrey, for that question. It's a great question. That is fairly classic for this urgency incontinence or nocturia, where you don't have that appropriate signaling to the bladder, where you get that warning, where when a normal bladder function happens, the brain tells you my bladder's full. You go to the restroom in a controlled fashion and use the restroom. So that signaling gets offset. So especially when you're asleep and your bladder is more full and you wake up and you don't have that warning time, sometimes, you know, it is more common for that to happen, and especially when the bladder is full where you just can't get to the restroom fast enough.
Again, joining us today is Dr. Stephanie Jacobs, member of the Urogynecology team at GBMC and pelvic floor reconstructive surgeon with GBMC Health Partners. I have a couple of interesting questions for you about that, so we're going to get to it. But we have another question from our audience.
Okay, so this question is from Lisa on Facebook. She wants to know if there are any exercises that can help you with incontinence support.
Thank you, Lisa. Well, that's a great segue to some of the information that one of our pelvic floor physical therapists will have a little bit later in the afternoon. Yes, there absolutely are exercises, kind of like doing Kegel exercises, I think are what people are familiar with. But yes, there are definitely exercises that can help.
Thank you for your question. I do encourage those watching us on Facebook and our audience members, if you do have a question, please submit it. You can also submit it on the comment section of our Facebook page. You good?
Yeah.
No, square. Don't get choked up. No, it's okay. Quick question for you. So what made you want to become a pelvic floor reconstructive surgeon? I'm just curious.
I'm going to try to catch my breath.
Take your time. No rush.
Excuse me. Lost my voice for a moment. Super weird. Well, I was so sorry. I was interested in women's health in general. I don't know where my voice went.
It's okay.
Goodness. I was interested in women's health in general, and I really liked I really liked the surgical side of gynecology. So within obstetrics and gynecology, I really felt drawn to the GYN side of things. This is like very bizarre. And And then within that, I really liked the patient population and the relationships that I was able to work with women on issues that impacted their quality of life and things like this, where you could really establish relationships. It wasn't dealing with the cancer or things like that, but it was a huge impact on women's quality of life and their basic functions. You know, again, we take for granted bowel and bladder function and that all of your parts that should be inside are inside. And when those things go awry, it just impacts women's health in so many different ways. And I think to be able to make an impact in that way and kind of get back to a more normal state was very satisfying for me.
Dr. Stephanie Jacobs joining us from the team of Urogynecology at GBMC. In case you are interested in making an appointment with Dr. Jacobs, our website is www.gbmc.org/urogynecology, and you can visit our site and you'll see there's a lot of great information about the team, the department, and also questions about certain conditions. So I do encourage you to visit the site. We're going to go back to pelvic floor disorders because, and it'll lead me to urinary incontinence because we're going to bring it in. If a woman suspects that she has a pelvic floor disorder, what should she do? What's her first step?
So I think the first step is really that broaching the subject. You know, that's the biggest hurdle, is being able to talk about it. And I think it's always hard to make that leap, but I think as much as patients can, try to make that leap and talk to someone, whether it's your primary care, your regular GYN, whether it's making an appointment with one of us. You know, I think sometimes people are worried that something should, maybe they're not sure if it's normal or not, and they're afraid to talk about it and ask. And, I would say that one of the main things is just don't be afraid. I mean, we're more than happy to help patients figure out if it is something that warrants treatment, and there is a huge range of types of treatment that could be.
Okay. In the intro, I mentioned about optimal treatment or treatments for people with pelvic floor disorder. So what is the most common prognosis or outlook after surgery for people who have a pelvic floor disorder? Part one of this question, and the follow-up for those with urinary incontinence.
Okay, so I'll take the second part first. So the outlook for surgery with urinary incontinence is actually quite good, typically. There are two main types, again, of urinary leakage. So there's the stress incontinence and then more of that urgency incontinence. So for stress incontinence, we actually have surgical treatments that are quite effective. For urgency incontinence, we don't so much. I mean, there are procedural options, and there are times where we'll kind of work with nerve stimulators or inject the bladder with Botox even. So there are procedural options that are effective, but less of a quick surgical fix. But for stress incontinence, there are very effective surgical options.
We have about 5 more minutes left on our show today, so I do encourage our audience members and those watching us on Facebook, please submit your questions for Dr. Stephanie Jacobs, pelvic floor reconstructive surgeon with GBMC Health Partners. We do have a question from our audience.
Yeah.
So we have a couple questions from our audience. We have 2 from Beth on Facebook. She wants to know if your team includes both practitioners and nurses, and if there are various treatments for urinary tract infections, such as putting antibiotics directly into the bladder.
Thank you, Beth, for that question. So our practice includes myself and my partner, Dr. Blomquist, and then we have 2 nurse practitioners who are actually in our office, as well as a nurse who we're all part of the same team. And so that includes care for the incontinence issues, for things like bladder infections, and then we again work very closely with our physical therapy colleagues as well. There are different things that we try to do to manage bladder infections, which are, I think, certainly a challenge as for a number of women, and we do see that as women get older as well. Sometimes we instill the bladder directly with antibiotics, and there's some mixed evidence for that, but it's that is something that we can incorporate.
Was there another question from the audience?
A couple. They just want to know all of the things. So we have a question from Cecilia. She wants to know what you think about Botox as a treatment option.
So that's great. So thanks, Cecilia. So Botox is an option that we do very commonly in our office, typically. Some people do it in the operating room. We typically do it as an office procedure. And that is an option for urgency incontinence. So that leakage, again, where you can't get to the bathroom fast enough, or really an overactive bladder in general. So women waking up at night a lot, women who are going all the time during the day with urgency, but maybe not necessarily with leakage. So we use it all the time for that issue, and it's actually quite an effective option.
Actually, I have a question that was submitted prior to the show from Bonnie, and she asked, because you mentioned about frequency of urination, she asked the question, how concerned should I be that I go to the bathroom at least 3 to 4 times during the night? I also have frequent urgency to urinate throughout the day, seemingly as soon as I finish drinking any type of beverage.
Yeah. So thanks, Bonnie. That goes along with an overactive bladder for sure. So waking up 3 or 4 times at night is, there are many different aspects to that. It impacts sleep, which impacts your overall health, which I think just, escalates into a number of different impacts on one's health. You may not be as physically active, and et cetera, et cetera. So while it's not dangerous in and of itself to wake up at night, it certainly impacts so many other aspects of one's health. The other thing with that is when we think of just the waking up at night, we do start to think of some other medical disorders and, looking into whether those are a factor, but often we don't find a specific additional medical issue for that. But we do sometimes think of whether it's a lot of swelling in the legs or heart issues or diabetes or things along those lines. So it is something worth looking into.
Sure. We got a couple more minutes left, so real quickly, 2 last questions. Is urinary continence a reversible condition?
So it's a good question. We think of the stress incontinence in a sense when there is a surgical treatment or a therapy treatment that it resolves. We know that those women will be at some increased risk for having that happen again. I tend to think of overactive bladder and urgency incontinence, though, as a little bit more, it's more of a chronic condition that we manage. And the last question is, are mesh slings safe? That's the last question. That's a tough one. So yes, we would say yes. Nothing is without risk, but yes, we have good evidence. I mean, they are extremely well studied. There's a lot of controversy, and that's the only reason why I paused a little bit, because there's a lot of controversy in our news about mesh. And, there are different reasons that mesh is used. Mesh for leakage of urine with coughing and sneezing is extremely well studied. We don't have any evidence that it's in and of itself unsafe. There can be complications with any surgery, and there can be complications surrounding it, but short answer is yes. Okay. I don't want to end the program with a tough question, so here's an easy one. Did you have a good time today? I had a great time today. I want to thank you for joining us. And I want to, that's all we have time for today. If you have any more comments or questions, please submit them on the comment page, on the comment section on our Facebook page. See? You had the vocal issues. My tongue is all tied. We have something going on today. Must be. I also want to thank our wonderful audience and those at home who watched our program today. And like I say all the time, if anything, I hope you all learned something new today. Please stand by as the conversation on pelvic floor disorders continues with Mary Beth Marsden and Don Scott on Greater Living. Hey, Mary Beth, I see you down over there.
How's it going? Good to see you. All right. Please join me here next month on To Your Health as we talk about something that's very important. I'm sure you all have heard about the blood shortage, the blood donation shortage within our nation. Okay, so we're going to talk about that, why it's important, if you can, to donate your blood, and what the GBMC healthcare system is doing as a whole to help address that issue. So I hope you join us here on To Your Health next month. I think it's Wednesday, January 9th. I should know that, right? I shouldn't be thinking it. Yes, Wednesday, January 9th, right here on To Your Health. Look for more details, of course, in the coming weeks on our GBMC Facebook page. And like I said, we'd love to have you join us. Before we leave today, I want to wish our audience, I also want to wish those watching us at home a happy and healthy holiday season, and everything you aspire, all the great things that you would like to happen in 2019, I hope they happen for you. So, Dr. Jacobs, I want to thank you for being here today. And until the next time, cheers, to your health.
Finish up my